When it comes to your health, quality isn't negotiable. That's why I've trusted my supplement dispensary to Fullscript, because every one of their 15,000 supplements is vetted, verified, and held to the highest standards. And now for 4 days only, every single one of those high-quality supplements is on sale. May 18th through 21st, 4 days only. Get 10% off and free shipping on the entire Fullscript inventory. It's the Fullscript signature sale happening May 18th through May 21st. Just go to dearhoffmanstore.com, stock up on the supplements I recommend at prices that make it even easier to stay consistent with your wellness routine. We're talking trusted brands, professional-grade formulas, everything in the catalog, no exceptions. You'll find innovative wellness products, too, all chosen for their quality and reliability. Don't leave your health to chance by buying from third-party sellers. Shop my Fullscript online dispensary, where quality always comes first. The Fullscript signature sale, May 18th through 21st at dearhoffmanstore.com. That's dearhoffmanstore.com.
You know that feeling when everything just clicks? Your mind is sharp, your mood is steady, your body feels like it's firing on all cylinders. That's not luck. That's what your body is capable of every single day. Now, I've looked into a lot of fish oil supplements, and honestly, most of them are mystery-sourced, over-processed, blasted with heat, and packed with synthetic add-ins. But this one is different. Omega-3 Rejuvenate from Big Bold Health starts with wild Alaskan salmon and cod, sustainably caught from some of the cleanest waters on the planet, and then it's processed at low temperatures to preserve what actually matters. We're talking about real omega-3s, naturally occurring vitamins A and D, and pro-resolving mediators, or PRMs, that help your body balance its own immune response. What does that mean for you? Clearer thinking, more stable mood, and real nature-based support for your heart and immune system. No shortcuts, no synthetic nonsense. And it was developed by Dr. Jeffrey Bland, a true pioneer in the world of complementary health. If you want to feel the difference, go to bigboldhealth.com/Hoffman. That's bigboldhealth.com/Hoffman and use code Hoffman for 20% off site-wide. Once you feel it, you'll know. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Today we're going to talk about an aspect of what I call intelligent medicine, or you could call it integrative medicine or comprehensive medicine, a modality that we have mentioned but we haven't done an in-depth on, which is something called HBOT, and no, that is not a TV network. It refers to hyperbaric oxygen therapy. Now, I am a scuba diver, so I'm familiar with hyperbaric oxygen therapy. If you get in trouble as a scuba diver and you come up too fast, you get the bends, and then you go into a hyperbaric oxygen chamber for a while to prevent nitrogen bubbles from coming out and wreaking havoc in your tissues and in your brain. This is referred to by divers as the bends. But there's far more to hyperbaric oxygen therapy than simply treating divers' accidents. Today we're going to talk to an expert on this subject, Nicole Garrett. She is the founder and COO of Under Pressure Hyperbarics, where she's redefining the future of health, wellness, and recovery through cutting-edge hyperbaric oxygen therapy with all kinds of applications. She has a lot of experience. She began her career at UC San Diego's Hyperbaric Chamber, and she has gone on to found a series of hyperbaric oxygen therapy centers to look at the potential to treat various medical conditions, but also to enhance performance. She's got a lot of background in dive medicine. We'll talk a little bit about that. We'll also talk about some fascinating applications of this therapy for anti-aging and athletic optimization and for treating various challenging healthcare conditions. So without further ado, Nicole, welcome to Intelligent Medicine. Thanks very much for joining us.
Yeah, thanks so much for having me. Excited to be here.
It's my pleasure. Okay, so first of all, you tell us a little bit about this because I think the maybe the first step is to talk about what happens to divers and why they have established that hyperbaric oxygen therapy is a good way to recover.
Yeah, so when you are diving, you're breathing a compressed gas, and that compressed gas dissolves in your body fluids. And as you come to the surface, that gas wants to expand. And if you come up too quickly, so you don't have your decompression stops, or worse yet, you panic and hold your breath, those bubbles come out of solution, so to speak, and create a blockage in your body. So most commonly, it's going to create a blockage in like an elbow or a knee joint or somewhere that's bent, and the bubble just can't clear.
It's
But once
extraordinarily
that
painful, right? That's why they
it's
call it
very
the
painful.
bends because you
Yeah.
double over in pain, right?
Yeah, they used to, in fact, even when I teach the course, we have a picture of the woman with the Grecian, or the big whale bones where they're bent over because a lot of times spinal decompression sickness, you can't even stand up.
Oh, wow. Okay.
So you are bent over. Yeah, so we use the hyperbaric chamber to squish down and recompress that bubble so we can move it out. But even once the bubble's gone, there's this whole inflammatory process that happens because that bubble was a foreign body. It blocked blood flow from getting from one side of the body to where it was intended to go. And so then you're also using the secondary action of the oxygen under pressure to mitigate the inflammatory response.
Okay, so this is just high pressure in a metal chamber with or without extra oxygen.
Yeah, with hyperbaric oxygen therapy, you would need the oxygen itself, but the primary mechanism is the compression. You wouldn't get the same effects if you just, breathed oxygen on the surface. So there is certain tensions you need to reach to get certain effects. So, and that's kind of dosed with depth.
So, how many times normal atmospheric pressure? I mean, it's kind of like the opposite of what happens when you go up to Mount Everest. You lose pressure, but this would be the equivalent in air terms of being underwater. You're actually multiplying the atmospheric pressure. Like how many times? Twice, three times?
Yeah, so for when we're treating divers, the first step we take them to is 2.8 atmospheres, which is about 60 feet seawater, and see if we get relief. Because that's going to take the bubble that's in your body down 2.8 times, almost three times reduction, and see if we get relief there. If that does not happen, we'll go to five times the pressure, which is 165 feet seawater, and do a different treatment modality starting at that depth.
So I hope I never end up in one of your hyperbaric oxygen chambers for that reason. I'm a careful diver. I do my gradual decompression stops where you ascend from a deep depth and then just hang out. And then you're in effect dissipating some of that dissolved nitrogen and all is good. You go on board and you go back, you have a cocktail and you celebrate and it's good. Uh, so, so, when was it discovered that there were additional benefits to hyperbaric treatment, that it somehow could be helpful for other types of conditions besides its narrow application?
Yeah, late 1600s, early 1700s, actually.
Wow.
It was discovered. They used to do operations in hyperbaric operating rooms before we
Wow.
even knew what oxygen was because the patients wouldn't turn as blue.
Wow.
And that was just because the increased partial pressure of even the air that you're breathing increased the oxygen for the patient who had, decreased respiratory drive from surgery. So they started with that. Then they figured out what oxygen was and didn't need to do them in the OR anymore. And the next application we really saw it applied to was diabetic wounds. So that's probably one of the oldest, longest treated applications is for diabetic wounds.
And so is that done with like a bag under pressure on the affected limb, or does a person go into a chamber?
Yeah, your whole body has to get compressed. They've tried localized hyperbaric oxygen therapy. The oxygen doesn't permeate through your skin, maybe a
Okay.
couple microns. So you still get the oxygen through breathing.
Hmm.
And we dissolve it primarily in your plasma because your red blood cells are already saturated. But that plasma can go places your red blood cells can't often. And so
Hmm.
if you have a wound that hasn't healed and it's leaking that kind of clear fluid, that's all full of oxygen now. And it's really those high oxygen tensions that go up from the chamber and the treatment, and then the rapid drop when you're done with treatment that stimulate the body to grow new blood vessels and release those stem cells. So it's a lot of that contrast.
Interesting. So it's better than, like sometimes you see athletes and, they after a long time on the football field, they rush to the sidelines, they put on an oxygen mask. But that seems like kind of a placebo treatment. I'm not sure that does a lot.
Well, I think it helps if you are somewhere like Denver.
Okay.
And you're not
Right.
used to living in Denver.
Right.
Because you don't have, there.
If you're
we're
playing the
really-
Rockies or if you're playing the Broncos or
Yeah.
something, maybe.
Yeah, I'm at sea level here breathing 21% oxygen. If you're at 5,000, 6,000 feet, you're not getting 21% oxygen. If you're used to exercising with that percentage, you're going to feel it.
Okay. So there's something to that, but there's more to the pressure because the pressure pushes the oxygen deep into the tissue. It gets through the capillaries deep into the cells.
Yes. Yeah, we're using the pressure and we really dose it with pressure. The majority of the research is done and shows that 2 atmospheres or 33 feet seawater, if you want to keep it in dive terms, is where you really get most of the beginning benefits of all of that. If you're not going that deep, there's no data to show you're not going to get particularly the collagen synthesis, the stem cell release, the angiogenesis, which is the growth of the new blood vessels. So you need that high tension to get that high contrast.
Okay. So this sounds like it's beneficial in any condition that has to do with circulation. So we can speculate, like maybe it's good for people who have cardiovascular problems, who had strokes in the immediate aftermath of a stroke or a heart attack. I've actually heard of people undertaking hyperbaric oxygen treatment to facilitate recovery from stroke. Is that been demonstrated to be helpful? Are there studies?
There is a lot of research showing it's helpful. It's not yet a FDA-approved indication. But there is a lot of data showing it, and we have a lot of patients that come in for that. We've also had patients that come in for something else, and it restores their cognitive ability from the stroke they also have. Stroke's really a traumatic brain injury, whether it's hemorrhagic or was from a clot, but you lost the blood supply to the brain and it can't get there. So if we can flood that area with oxygen again, start to wake up some of that tissue, and then over time regrow the blood vessels in the area that it was damaged, then it makes sense that it would, treat that indication.
So, to some extent, this is a conventional modality, certainly for diving accidents, certainly for wound healing. I think you can get that done and it is covered by insurance. But then when it comes to stroke recovery or other things, maybe someone has cognitive problems, mild cognitive impairment, or even dementia, that's when you take on the burden of self-pay. You pays your money and you takes your chances, so to speak, right?
Yeah, exactly. What they would refer to that is something that's like off-label.
Yeah.
Because it's not one of the 14 approved in the US anyways, indications. So it's off-label, then it becomes out of pocket. We've had some success with some outlying cases where we can actually get a peer-to-peer, where we get our doctor on the phone with their doctor and argue the case and why the mechanisms of action should apply. And they have paid for that, but it's pretty few and far between still.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
Thanks for listening. Thanks for supporting our sponsors. They are what make intelligent medicine continuing free resource to you. And now back to today's guest, Nicole Garrett. How about in the realm of athletic performance? I mean, there's this whole thing, especially endurance athletes, who do things like blood doping. That increases the number of red blood cells. That supposedly enables the body to deliver more oxygen to the tissue. I mean, you can't do a triathlon or an ultramarathon while carrying a hyperbaric chamber, but is there any evidence that getting treatments before or after can enhance performance athletically?
So there's kind of two answers to that. One way people also can blood dope without actually blood doping, where they take out your blood and inject it back in, is you can sleep in a hypobaric chamber. A lot of athletes go
Yeah,
live with
that's the
Big
opposite.
Bear.
Yeah.
Yeah, it's the opposite. So you're depriving your body of oxygen at least 10 hours a day. Nike did a big study on this. You could look up the Nike project. You deprive yourself of oxygen for 10 hours a day, not 100%, but a reduced amount, or sleep in a hypobaric chamber, and you naturally will build more red blood cells to compensate for that. And
Right.
so then when you go train or compete at sea level, you naturally have that. When you do a hyperbaric treatment while you're in the chamber, you have those increased tensions. And then when you come back to the surface, it doesn't take very long, just like scuba diving, to reduce those tensions back to normal. So it's not sustaining in your blood maybe while you're on the field, unless you just got out and ran out there. You do have a few hours, up to about 6 hours, where it shows higher. But we are starting to see, particularly with our surgical patients, if they do pre-treatments, that when they get to the OR a day or two later, the doctors are noticing better perfusion during surgery. So they're having less failures. So I think that would lend to athletics, where, we aren't cutting you open to see it, but we could probably start doing some studies on how long those tensions really do last and benefit you.
Sometimes we see a disconnect between what is common practice in the United States versus other countries which may be more innovative in terms of applying this therapy. Is that the case with HBOT?
100%. I mean, even in our veterinary world, there's 126 approved indications to treat your dog or your cat or your horse in a hyperbaric
Oh, I
chamber.
see. Yeah.
And, we're mammals, so it's not like some of the rat models that don't transfer to humans. Like, we respond to oxygen the same. And most other countries have far more things that they treat under their kind of healthcare plans or systems. Japan has almost 200. They're much more progressive. They use it much earlier. Even for us here in the US with something like a diabetic wound, they wait till it's what's called a Wagner 3 or 4. So they wait till it's really far progressed
Yeah.
into the bone before they treat, instead of treating it before it ever gets there.
Right. And which would make more sense. And it really is, in study results, it might make it more likely that in someone that far gone, the HBOT would be less decisive because it's kind of a last resort. It's kind of like the way sometimes they do cancer trials with innovative treatments like intravenous vitamin C. And they say, well, see, it doesn't work if you have stage 4 metastatic cancer and you've run out of options with surgery, chemo, and radiation. It's the, kind of a Hail Mary treatment.
Yeah. And unfortunately for a lot of those patients, instead of treating the wound, we're just deciding how far we amputate instead of, preventing ever getting to the option of amputation.
And what about in the realm of cancer? And this is controversial because the notion in cancer is that cancer is an anaerobic disease, is that cancer in some way walls itself off and conducts a more primitive form of metabolism that is not oxygen dependent. It's anaerobic, and that by flooding cancerous tissue with oxygen, that somehow it can facilitate healing.
Yeah, we are starting to see that a lot more. On our website, there's a link for cancer that brings up, I think, 200 different studies on it, if you want to kind of deep dive on it. But you're right, they're starting to do increasing studies on using it adjunctively with chemo and radiation, particularly with timing.
Yeah.
Because if we can do the hyperbarics and the cancer starts to open up because it's trying to push out all that extra oxygen, and then you hit it with the chemo or the radiation, or if you're more alternative, the high dose vitamin C or the mistletoe, it's more receptive to it. So they're finding they have to give you fewer doses of the chemo, lighter doses, and it's more effective.
Wow, that's really fascinating. So there's also some speculation that there may be kind of a dual synergy with something like a ketogenic diet, that is, and this is actually a popular notion. Can you explain how that might work?
Yeah, so we're finding cancer's got two major food sources, so to speak, glucose or sugar and glutamine. And so especially if you've got a glucose dependent, and that's because, your body switched from normal oxygen dependent ATP and mechanisms. So now you're starving its fuel source with oxygen from sugar, and then you're hitting it with oxygen, trying to reverse it out. And I think it was actually Quest Nutrition that started some of those biggest studies trying to
Oh,
cure
okay.
cancer in dogs, that started putting them on ketogenic diets coupled with hyperbarics that lent to the human studies.
Wow. Okay, so that's kind of hitting it in a couple of ways, and naturally uh, inhibiting the kind of metabolism that causes cancer to proliferate.
Yeah.
So it, in effect, starve it of nutrients, but also flood it with oxygen so that it may revert more to normal metabolism.
Yeah. Yeah. And once it reverts to normal, that off switch kind of, I don't think the cancer cells itself turn back on their normal cellular death, but they no longer survive. And then your body can heal from the inside.
So one of the more controversial applications of this is in neurodevelopmental disorders. There's no more activist community than the community of parents of autistic children, and they're looking for answers, and some of the answers are speculative, but if they're not harmful or dangerous, they're worth a shot. And one of the modalities that is embraced by that community is hyperbaric oxygen. Is there evidence that that might be helpful in? Are some of your clients coming in for that?
Yeah, so actually early in my career, when I was still at the university running their new satellite center, we had a physician come out who was buying a hyperbaric chamber for the Middle East. And because she was a woman, she had to run it herself,
Right.
primarily for autism research. And at the time, she was saying, we notice in autistics that they actually have somewhat times almost double the brain cells that we do. And so they're fighting a lot of noise. And so her aim was to see if by doing hyperbarics and using the growth of blood vessels and kind of connecting those neurons, if we could connect more of them, that they could get them functioning more normally.
This is the
And
theory that
so,
in autism, that it's not so much a lack of brain cells, but that there's a proliferation of brain cells, and that the normal pairing or
yes.
cutting back of brain cells results in, like you say, static or excess brain noise, and that this process of differentiation and paring down is incomplete in autistic patients. So the thought is that oxygen may support that.
Yeah, the thought is, if we can either regrow the blood vessels or connect some of those neurons in ways that they're maybe not functioning, then the brain's pretty neuroplastic. It can learn to use the tools, or just maybe not connected. I think the restriction on does it work, does it not, is a lot of the research in the US, because it's still considered that off label as being done in these more mild hyperbaric chambers. They don't go as high in pressure. And so it may just be that they're not getting enough pressure to get the more definitive results, or they can't go as frequently because of cost or other reasons. So we don't have as much good, clear research here
Right.
on that.
And so that's an important point, because for consumers, there are integrative doctors and health centers that offer hyperbaric oxygen, but in what are called soft chambers. And I've seen them. They're kind of like tents, and they pump in some oxygen at some pressure. But what's the difference between units, which I guess are made of reinforced metal, versus units that are the so-called soft units?
Yeah, the soft units, or now we're even starting to see some hard units, but they're only capable of softer pressures because they don't have the thick enough steel or windows. They were actually developed and approved to treat altitude sickness
Mm-hmm.
or acute mountain sickness. And so it's a small amount of pressure to bring you back, basically equivalent to sea level, so you don't have those altitude sickness symptoms. But they're only going to maybe 1.3 atmospheres. It's
So that's
not,
30% more than what you'd get at the at zero altitude, at sea
yeah,
level.
yeah, but it's still not 100% more.
Mm-hmm.
And the studies we have now show you just begin to get some benefits at 50% more, or one and a half.
Mm-hmm.
but really you want to go double to 2.5. And that's kind of the sweet spot for most indications.
Okay. So this is a good launch point, a good way of grounding our discussion in part two. I want to talk in part two about, what it practically entails. What are the treatment protocols like? What are some of the other conditions that might be amenable to this? And of course, a cost factor, because that is a consideration for people considering this therapy for themselves or for a loved one. So when we return, more on the subject of HBOT, hyperbaric oxygen therapy. Our guest is Nicole Garrett, founder and COO of Under Pressure Hyperbarics. Give us the heads up on how people can find out about your centers.
Yeah, we're at underpressure.com and we're on pretty much all socials at Under Pressure Hyperbarics. It's usually the easiest way to find us. We're currently in Los Angeles and Beverly Hills. We have a couple facilities.
Okay. When we return, more on hyperbaric oxygen therapy. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast.